There are people out there who don't have a voice or feel their voice is not loud enough. And when I got into Congress, I really felt I had to be there for not only those people, but anyone else.
Congresswoman Matsui is a leader, a champion, somebody who will go above and beyond on behalf of patients and her constituents.
The work that we do requires a lot of resources, including funding from the federal government, in order for us to grow the registry, for us to do the research that we do.
Representative Matsui has been instrumental to the organization. Her support for the C.W. Bill Young program has ensured critical dollars have been given to NMDP each year. Those critical dollars have been so important for patients, not only from a financial assistance perspective, but also our ability to recruit more donors, especially donors with ethnically diverse backgrounds, to ensure that we close the gap that exists today for patients.
Through her personal loss, she has come through to save countless lives through her work in Congress.
My late husband, Bob Matsui, he died on January 1st, 2005. It was myelodysplastic syndromes, which is called MDS, which is a failure of all the 3 types of bone marrow. My mother had cancer, my father had cancer. I never thought it would happen to Bob. And at that time, people were not advocating. So when people started reaching out to me, then I thought, this is real, and we need to do something about it.
To have a champion in Congress who sees the struggles that our patients go through, who knows and understands what it's like, and then to not only take that on personally, but lead and work with 435 other members of Congress to get legislation passed, to get funding to make sure that those patients get the transplant they need when they need it. She works bipartisan across the aisle. She leads in her committee.
The federal funding for the C.W. Bill Young transplantation program is not guaranteed. It is that continued dedication that will allow for future funding to help save 10,000 lives every year.
She knows how the system works. She knows how to get these bills done. She knows who to talk to, and she'll approach them on the floor. She'll approach them at events.
In order to really have any effect in Congress, you have to break it down to your fellow colleagues in a way they'd understand. I collected a lot of experiences and stories about this particular disease.
It's one thing to talk about data. I think telling individual stories is still the key.
One of the really unique things that Ms. Matsui has done is she actually is co-chair of the Caucus to Cure Blood Cancers and Blood Disorders, the caucus that supports our funding, that supports the existence of the C.W. Bill Young cell transplantation program, that allows for the nation's registry, allows for us to collect data and have outcomes data so that way we can help improve people's lives.
I really believe that this is important work. Congress should not be a place where you do a bill, it gets signed, and you check it off. It has to be constant and sustainable.
I think sometimes our government partners are overlooked. You have to have partners in Congress in order to do what we do. We can't do it alone.
To me, it's a passion. We're going to be doing a lot of research with bone marrow. That research can help other diseases. And we're doing so much with cell therapy now. Who knows what can happen?
I don't even know if she realizes the number of lives that she has touched, that she's impacted, the number of families that she's given more time to. She refuses to quit, and she keeps pushing forward. I can't think of anybody more deserving of this Lives Award than Congresswoman Matsui.